I want to sort of go towards the conclusion of my talk to examine the question of whether Strep zoo, an emerging pathogen of significance for dogs in shelters, is it a primary pathogen able to cause disease by itself, or is it a secondary pathogen that really requires a boost from something like a viral infection in order to contribute to severity of the disease and maybe tip the dog over the balance to death? It is known that secondary bacterial infections of the respiratory tract in many species is promoted by virus-mediated damage to the respiratory tissues, both in the upper respiratory tract and the lower respiratory tract. And this virus-mediated damage actually promotes bacteria sticking to the tissue and initiating a secondary infection, in addition to the virus. Not only that, but the viral infections, particularly the ones that we know about in dogs, can paralyze that mucociliary apparatus, the beating cilia lining the trachea and large airways going down into the lungs. And it's a natural defense mechanism that is constantly sweeping bacteria away from the lung in healthy dogs. But viruses paralyze that for a week, 2 weeks, sometimes 30 days, and that also contributes to susceptibility to a bacterial infection. So I'm going to present some evidence that I think is accumulating that this actually may be a secondary pathogen. For instance, if we go back to the Strep zoo outbreak in the United Kingdom shelter in 2003, dogs with canine infectious respiratory disease were more likely to have Strep zoo in their lungs than dogs that did not have respiratory infection. As a matter of fact, of the 39 dogs that had Strep zoo in the lung that were tested for other pathogens, 44% were co-infected with canine parainfluenza virus, canine herpes virus, or canine respiratory coronavirus. Not all dogs that had Strep zoo, but almost half of them had a concurrent viral infection. And then in the Las Vegas shelter in 2008, the lungs from 5 dogs that died of Strep zoo were tested by PCR for viral pathogens, because this is about the time that PCR became available. And all 5 dogs that were tested were infected by a virus, whether it was herpes, adenovirus, or distemper virus. So here's some suggestive evidence about the role of viruses with Strep zoo. And then in 2008, all 11 dogs that died of Strep zoo in the Florida shelter were tested by PCR for viral pathogens. Only 2 of the 11 had a virus infection. It happened to be influenza virus. So within a couple of days of learning of these dog deaths, I went down and collected nose and pharyngeal swabs from 22 other dogs in various parts of this very large shelter, and tested them by PCR for viral infection, and they all had either canine influenza virus or canine respiratory coronavirus, or both. So this told me that canine flu was in this shelter. And at the same time, dogs were dying of Strep zoo. So could it be that flu virus infection actually does predispose to Strep zoo? And here are 3 points that are known. I don't know if flu does. If canine flu predisposes to Strep zoo, or if it's just associated with without cause and effect. But it is known that human influenza viruses predispose people to secondary lung infections by Streptococcus bacteria, Strep pneumoniae. And people who have flu and a concurrent Strep pneumonia infection have very severe pneumonia requiring hospitalization. In addition, the same scenario exists with horses. Horses who are infected with equine influenza virus are very predisposed to secondary lung infections by strep zoo. And when this occurs, the horse has very severe pneumonia. And there's been a very recently published study this year that showed that experimental infection of dogs with canine influenza virus and a very virulent strep zoo bacteria isolated from one of the outbreaks caused much more clinical disease, severe clinical disease and pneumonia in those dogs with the dual pathogen infections than dogs infected with either alone. So it could be that canine influenza virus in dogs, just like in horses and humans, may be one of those viruses that triggers susceptibility to strep zoo. Certainly more work needs to be done to examine this linkage. When we consulted with the Florida shelter, the one that had the recurrent strep zoo outbreak in 2011, we actually went down there and found that they had widespread distemper. And nearly 400 dogs or more had been exposed to this virus, and many of them were already symptomatic. We didn't know strep zoo was there. We thought this was just a distemper outbreak, one of the many we have in Florida, and that's what was going on, although it was a very extensive distemper outbreak. But when we tested nasal and pharyngeal swabs collected from 43 sick dogs using the PCR panels, we found strep zoo. As a matter of fact, 30% of those 43 dogs had strep zoo. And not only that, but strep zoo was found in dogs that were co-infected with distemper. See, none of them had strep zoo only without a virus. Or it was found in dogs that were infected with a virus other than distemper, and these viruses were respiratory coronavirus, herpes, parainfluenza, and adenovirus. So yes, distemper was the primary pathogen in nearly half of the tested dogs, but 30% of the dogs were infected with strep zoo, and all of the strep zoo infected dogs were infected with a respiratory virus. So this is another piece of evidence that suggests the importance of underlying viral infections for strep zoo.